Colm Nagle. I'm the Managing Director of Claimsure Sláinte Ireland, and today we're looking at integration services across the health sector. In terms of having integration in the health sector in Ireland, we have legislation requirements that you have to meet, EU requirements, one of being that we need to be able to share records across the EU. If I get sick in Paris or on my nice sunny holiday in Spain and I end up in hospital, by 2020 we have to be in a position to be able to share a medical record between the two countries. Today that's not possible because we don't have a standard medical record and a standard method of collecting that information across the health network. And keeping in mind that the health network is both the private sector and the public sector. So to be able to do that, again, you need to have an integration system that crosses the boundaries. And again, Claimsure is uniquely placed to provide that service.
And information is now the utility for healthcare.
Claimsure, who are we, what have we done? Well, I suppose one of our claims to fame right now is that we put a financial system for managing healthcare claims to the private health insurance in all public hospitals and in a number of private hospitals. We're looking at having health records in multiple places and coming from multiple systems with data from the cradle to just before we go into the grave, all the way up to the older age group when you're looking at the nursing homes and everywhere in between. And that's the challenge that faces us today, is to find ways of connecting all of that data. And the information that we're looking at, again, is a range of information from patient demographics to clinical information, and you've got labs and RADs and all of these diverse systems. In a lot of cases today, they don't talk to one another within the public system and the private system. And it's the same problem across it. Excuse me. There are many private hospitals as well who have face the same issue as the public hospitals do. The systems they have in place are there a long time. They weren't designed to talk to one another. There wasn't a need to do that back at the time when systems were put in place. The goal of Clanwilliam Health is connected health. And any companies that we add to the group of the Clanwilliam Group is to carry us along the path of that goal. And it's to facilitate the flow of information between healthcare professionals. It has to be accurate and it has to be fast. We're working with eHealth, we're working with the HSE in many different areas, and we're working on some projects with them on the health identifier as well as part of that, how we can integrate that to some of our solutions as well. So there's lots of technologies involved, and we're adding new technologies all the time to the group.
It all starts with Iguana. Iguana is an enterprise caliber integration platform that enables healthcare organizations to integrate any information system, regardless of data or sending mechanism. So this is a proven and high performing solution. Iguana has been used to process and transfer millions of messages per day. And it has a very small footprint. And what that means is Iguana doesn't require any sort of special hardware, has no dependencies on a database. And that's really important to note when you're looking at ROI. Spending money on hardware just doesn't make sense if you're looking to keep your costs low. I'm also really happy to announce that we are working with Claimsure as our service partner here in Ireland. So as our partner, Claimsure has been using Iguana for many years. They've created a best-of-breed solution that many of you are familiar with. Having a partner in Ireland that understands your projects and your goals is huge for us. And we're excited to get to work helping you.